Good morning, my name is Kevin Stritt. It is a pleasure for me to present my work about is expanded disability status scale enough to predict risk for upper urinary tract damage in patients with multiple sclerosis. So we have no disclosure. Context and objective. Neurological lower urinary tract dysfunction is very common in patients with multiple sclerosis. That dysfunction not only has major impact on quality of life, but might even lead to upper urinary tract damage. While there are well-known urodynamic risk factors for upper urinary tract damage, well-established clinical prediction parameters are lacking. An expanded disability status scale superior than 5 has been previously reported to be a good predictor of urodynamic risk factor for upper urinary tract damage. The aim of our study is to evaluate whether EDSS and/or other clinical parameters are able to predict urodynamic risk factor for upper urinary tract damage in our multiple sclerosis population. For that work, we retrospectively reviewed 201 patients with multiple sclerosis referred for primary urological workup, including urodynamic investigation. A multivariate logistic regression model was used to evaluate any association of clinical parameters and the occurrence of urodynamic risk factor, including bladder compliance inferior than 20 ml per centimeter of water, maximum detrusor pressure superior than 40 cm of water, vesico-ureterorenal reflux, and detrusor overactivity combined with detrusor sphincter dyssynergia. For the result, the multivariate modeling revealed EDSS, male gender, and absolute number of lower urinary tract symptoms as clinical parameters significantly associated with urodynamic risk factor for upper urinary tract damage. Exclusive use of EDSS cutoff of 5 as previously described in order to detect urodynamic risk factor in our multiple sclerosis population showed low sensibility and specificity. In that context, a nomogram combining EDSS superior than 5, male gender, and number of lower urinary tract symptoms allowed to better estimate individual risk of urodynamic risk factor for upper urinary tract damage. In conclusion, a nomogram including EDSS superior than 5, male gender, and number of lower urinary tract symptoms seems to allow risk prediction of urodynamic risk factor for upper urinary tract damage in multiple sclerosis patients. This finding needs validation by larger multicentric study.